Good afternoon. I'm Dr. Danzer. Welcome to SCRC webinar. We'll talk about fertility and IVF, and we have a special guest, Miranda, for later on. We'll talk about her journey with IVF, a very courageous journey. Uh, Give her some insight into how to build a family. But just to tell you about SCRC, you've come to visit our website. We've been here since 2000, 25 years, probably one of the oldest and largest IVF programs here in Southern California. We're very proud of that. I'm the co-founder with Dr. Mark Siri when we decided to create a standalone IVF center. We wanted the very highest quality laboratory and professional staff to give us the highest pregnancy rates. And again, to support that with a very human approach in terms of how we take care of our patients. I always, towards the bottom that we talk about the grandson of a midwife, and I always told the story of how my father's mother in rural Montana, late 1900 or late 1800s, early 1900s, had 11 children, and she was a midwife and traveled on horseback for women that locally had to needed help with their labor and delivery, as there wasn't too many doctors in Montana in those days. And what she had in her armamentarium of helping women was really pretty minimal compared to in vitro fertilization. And, that's changed just in, 1.5 generations. So let's get started. We'll go to the next slide. We have, you see on the right there, we have several locations. Our first location, Beverly Hills, and then we have another in Santa Barbara and in Pasadena. And we have one in Ventura also, because you have to sort of go out to patients for monitoring and so on. So we talked about, a premier laboratory. Dr. Suri and I were embracing the really new technology that was occurring with in vitro fertilization of being able to inject a sperm into the egg. Prior to that time, you put sperm on top of an egg, and if the sperm wasn't good, you didn't get embryos. But with the development of intracellular sperm injection, that was almost a cure for low sperm count issues and continues through today. And then the other part of the equation is the egg and being able to fertilize the egg and then grow the egg in the laboratory for 5 days. Used to be we could only grow for 2 or 3 days, but allowing it to grow for 5 days gives you a much better picture of the quality of that embryo structurally. And then you take a few cells and freeze the embryo and then do genetic testing, which was a real breakthrough in fertility treatment because genetics of the embryo is the prime driver of success rates and low miscarriage rates. Here at SCRC, we have what they call an embryoscope, which is a way of growing embryos without taking them out. There's imaging, and you can watch an embryo grow for 5 days, but you don't have to take the embryo out to look at it, to expose it to changes of light or temperature or anything else. And it actually helps to improve the progression of that embryo to day 5, so you have more embryos to genetically test. So just kind of start from the beginning of, we talk about first consultation to really go over and review what an individual's history is. That tells us a lot about what directions we take in terms of treatment, whether it's fertility medications or intrauterine inseminations or IVF. Finding a sperm donor. There are many opportunities to look at several sperm banks here in the Southern California area and even nationwide. And we are always happy to help someone find a very good match in terms of sperm donor. And then the journey through IVF. I think websites have become very sophisticated in helping women, couples view what the process is. and how complicated, but how manageable it is. And I think that's been a very big help. The staff is tremendously important in terms of helping patients go through IVF or any fertility treatment. It takes a lot of kind of interaction and direction, and but a lot of education comes to the process. Learn more about your physiology and fertility. Go to the next slide. There's Miranda's picture. I was talking, I didn't. And Miranda's
Hi,
going to
I'm
visit with us
Miranda.
a little bit later. We're really happy to have you with us today and to share your experience of fertility. So we'll come back to that very soon. Next slide. Decided on Dr. Danzer as a doctor, and I have a lot of patients that come in for consultation, and you ask them how they got there, whether it's a doctor referral or friend's referral, and I don't know, say 20 or 30% say, well, I saw you online, and somehow it just seems like a match. And I think there's some people that just gravitate to others in terms of who they are personality wise. And I think that's an important thing, that you need to feel comfortable with your doctor, that uh, you're both on the same page in terms of how to move forward in the treatment process. All right.
So I came to SCRC and to Dr. Danzer because I knew I wanted a family. And at 30, I was married. My partner decided he didn't want a family. And so at 32, I came to the clinic and just decided I wanted to freeze my eggs to have an insurance policy, to have the option of having children later in life. I met with Dr. Danzer, and he was very informative and just very comforting. And I really felt empowered. This was before even doing the egg freezing or knowing what my ovarian reserve was, just kind of the initial consultation and getting the lay of the land. Next slide, please. Yeah, so we decided to do an egg retrieval at 32 in January of 2020.
That was a big decision in life, 32.
Yeah, and I couldn't be more glad that I did it.
Well, it's always intimidating when people hear about IVF and they've had friends that have done it and have good experiences and not good experiences. And everybody says, well, how long is this going to take out of my life? I'm busy. I've got a job. I've got responsibilities. And how do I get myself through this? And again, after the first initial testing, we look at blood work. There's an AMH blood work. It tells you about your egg reserve. Then you do an ultrasound, which measures or counts the numbers of follicles, eggs in the ovary. So then you can decide on the kind of stimulation protocol. If you have a big reserve, then you don't need a lot of stimulation, dosage wise. If you have a smaller reserve, then you use a higher dosage. And the stimulation takes about 12, 14 days because you have to have a mature egg. And eggs to mature take about 12 days. Women ovulate day 12 or 13. You can't fertilize or freeze an egg unless it's mature. So unfortunately, that's the process for IVF or to uh, do an egg freeze cycle, is you have to do the injections of follicle stimulating hormone. But the FSH has been available for over 30 years. Tens of millions of women have done IVF cycles. There's no cancer, there's no early menopause. You're essentially bringing to maturity would be wasted eggs. Every woman starts with multiple eggs at the beginning of a cycle. And with a natural cycle, one follicle, it becomes the dominant follicle and moves in front of the others. And humans don't have litters, they just release a single egg. They may start off with 5 or 10 or 20. But then those other follicles diminish or are essentially wasted. So the IVF cycle is to retrieve eggs that would otherwise not have a life, to fertilize them or freeze them. But it takes about 12 days. And so coming in for a blood test and ultrasound every 2 or 3 days to look at the progress of this maturation of the eggs. And then once you get mature eggs, we do what they call a trigger shot and retrieve about 36 hours later. And that's an easy process, takes 15 to 20 minutes with a very light anesthesia. And most ready to go in an hour, hour and a half, and take Tylenol afterwards. There's no incisions. It's all done with ultrasound. It's a very safe, quick procedure.
Like Dr. Dancer said, it was very easy coming in every other day and very exciting to get to see the ovaries, the eggs mature. And you get to know what to look for in the ultrasound. And so every other day when you come in and have your tests, you're dealing with the other staff at SCRC who are wonderful. And you get to know them again, because you're making a lot of visits every morning.
But you
And
learned a lot
then,
about ovarian physiology as you watch those follicles grow and the estrogen rise. And
yeah, and it's exciting. It's exciting to get to see what you hear Dr. Danzer talk about when he's describing the process. And then each afternoon, every other day when you go in each afternoon, I would get a call from Dr. Danzer
so you don't have to
updating
miss
me
any
on,
work. You come in the morning and have the blood test and ultrasound, and we get the results in the afternoon. We give a call. So, a lot of women are saying, well, gee, gonna have to take up off work. You don't. Take off the day of retrieval, but that's about it. So,
yep, I missed I think only a half day,
yeah.
the day of retrieval.
But you felt well afterwards and you took Tylenol and it wasn't
I did,
particularly.
and I didn't have any trouble with the medication. I've heard a lot of people talk about the shots, and I'm diabetic, so it wasn't an adjustment for me, but they weren't painful, and the pharmacy was really helpful. They deliver it, and there's very clear instructions. So it's not really intimidating at all. And then if I ever had any questions, I would just email Dr. Danzer's team through the online portal, and I would have an
And the
answer to my
needles are really
question.
small. They're like insulin. They just go under the skin. It's a technique that's very easy to learn. And you learn a new skill along with the process. So,
Exactly. Yeah. And I was a little bit, I would say, moody because of the hormones, but nothing unmanageable. It didn't affect my work or anything.
most complain about, swelling. As your estrogen gets very high towards the end, each follicle makes estrogen. So if you have 20 follicles, you got a lot of estrogen. That fluid retention goes away within a few days after retrieval or begins to decrease. But that's probably the main complaint is that people say, I feel really bloated.
Yes, I definitely noticed a little bump.
Yeah. And it's just a function of your ovaries making a lot of your own natural estrogen. And again, that's the safety of the process. The injections just tell the ovary to make follicles. It has no effect on any other organs of the body.
So we did the retrieval in January, right right before the
Right.
pandemic. Um,
Yeah.
and I was excited and ready. And again, I took a half day from work, and the anesthesia didn't have any negative effects. You go to sleep, you wake up. Um, and the on-site support was great. It was kind of a non-event. It didn't seem
Well,
very
you were a
dramatic.
great person to work with. You had all that good positive energy, and that goes a long way in any sort of medical project. You did really well. So the day of the retrieval, we find out how many eggs we have, and a goal is kind of 15 to 20, but it depends. Some women have 8 or 10, and some have 30. Depends on just genetically who they are and how that woman's ovaries contain how many eggs. And um, our goal is 15 to 20, and some women have less than that. They do another cycle, but you were lucky. You had a very good reserve.
I was very lucky. We got 38 eggs and then 35 mature. Um, and then, and when we froze those, and then after, I guess last year, 2024, I decided, actually 2023, I decided that I wanted to become a single mother by choice. So I started looking through sperm banks, and I ended up going with California Cryobank. And then I contacted Dr. Danzer to ask for his input, if he would mind kind of approving the donor that I chose. And I reached out to you also to ask what the most important thing was, and you said age of at donation, right?
That's right, yeah. And most sperm donors are 20-year-olds, and that's, again, genetically when you have the best sperm. So, but
Yeah,
again,
you're at an advantage when you go to the sperm bank instead of with your partner when you're ready. So I chose a sperm donor and then sent you all of the information, and you gave your seal of approval. And it was really an interesting process to choose a sperm donor because I could involve my family and my friends, and really I did genetic testing so that I could compare the genetic testing of the donor with my own and make sure there were no overlaps. Um, and it was just a really interesting process and fun and kind of informative to have those conversations with family members. Do you want your child to look like you? Do you want to have common interests with the donor? A lot of the profiles include things like interviews, which I found to be kind of the most moving because you could hear the voice of the donor and then hear about why they donated, which to me was really important.
and some are PE majors and some are physics majors, and some are creative,
Exactly.
they're musicians, and some of that is genetic. There's no question about it.
Exactly.
So the next stage is once you have a selected donor, they transfer the vial of the donor sperm, and you make embryos. They inject a single sperm into the egg, and then we grow the embryos for 5 days. And you can see this little video to the right. This is 5 days of growth, a 100-cell embryo, and the embryologist is taking 3 or 4 cells from that embryo. It doesn't damage it. They just laser off a little piece. Then they freeze the embryo and send the cells off for genetic testing. Here's a nice video of what it's like an embryo, 2, 4, 8 cells. That's what we all looked like a few years ago. We got to the 30 or 40 cell stage, and after 5 or 6 days, you'll see what they call a blastocyst, a 100-cell embryo, where you can see fetal stem cells and placental cells, and uh, our embryos became who we are. Uh, but the ability of the laboratory to grow embryos is very, very good today. We talked about embryoscope is allows embryos not to be disturbed, and they watch them in terms of how symmetrically they divide. You like to have 2, 4, 8 cells in the very beginning. Some embryos go 1 to 3, 2 to 5. Those embryos maybe don't have the same potential as the ones that go to 2, 4, 8. And so you can rank embryos. The ones that divide symmetrically are the kind of the lead embryos, and you transfer those first. And that ultimately helps to uh, achieve the pregnancy at a sooner time, and pregnancy rates can be about 15% higher because you're selecting out an embryo that's grown symmetrically. So here are the outcomes of IVF, 38 follicles. or 30, and 38 eggs retrieved, 35 mature. Maturity is usually about 80%. And then in 2023, uh, 15 eggs remained frozen, 20 were fertilized. And again, 15 to 20 to thaw and fertilize is the general guideline. And then you end up with day 5 embryos to biopsy. And then they freeze the embryo because it takes a week to get the genetic report back. And out of that group, 3 were normal embryos, which is kind of the average. Um, Embryos stop growing or they're not balanced because of it's a very complex process. You're looking at 23 chromosome pairs that have 30,000 gene pieces. So in some ways it's amazing we all got here. We're all unique since the beginning of time. But here we have 2 girls and a boy. Pretty nice.
Yeah, that was exciting too, to be able to have enough mature eggs to decide to keep some frozen in case I choose to have, I have a partner in the future who wants biological children, but to also have the option of 3 different embryos and to be able to pick the sex of the baby.
And does someone know the gender and they want to surprise, and others say, well, we want to start with a girl or a boy and balance their family. Um, that's one of the advantages of doing genetic screening, absolutely.
So deciding to transfer the boy was, I asked you and you said the healthiest embryo, and the boy developed more quickly, I believe, than the 2 girl embryos.
That's right.
And I got some input. This is a video of my transfer.
Right. So on the screen there, it shows the embryo. It's just that they're loading in the catheter to place it in the uterus. So you get to see that embryo, kind of the first baby picture. You see that little ball is about 100 cells, and they're just seeing that the embryo will kind of scoot right up into the catheter. And the transfer of the embryo takes 5 minutes. It's really very simple. It's painless. It's just done in a regular room. No anesthesia is needed. Uh, it's a little bit crooked on that side, but you can actually video the transfer itself and see the catheter go to the center of the uterus, which is just about 6 to 8 inches. A little drop of fluid comes out of the catheter with the microscopic embryo. I'm going to draw the catheter and essentially go home in 15 minutes and take it easy for 2 days. And then about, I don't know if you can see that on the screen, you see a little white line that's going to the center of the uterine cavity to release that drop of fluid with the embryo. And high quality embryos adhere to the wall of the uterus probably 95% of the time. To achieve a pregnancy, again, it has to do with the genetics of the embryo. We know that embryos don't fall out, but it takes about 10 days for the embryo to develop to billions of cells, and then you can measure the pregnancy hormone in the blood. The big wait for 10 days. What did you do for 10 days?
It was it was a long 10 days.
Yeah.
I definitely felt the early signs of pregnancy before the 10 days. But it was, I was so excited. I had no real nerves. It was just pure excitement.
Yeah, we tell everybody to, have fun, have treats, good night's sleep, get all the positive energy. But it's the big wait for 10 days. What did you do on the day that you got the positive results?
I I don't even remember. I was so elated. I think I was probably on my phone just calling everybody, calling and texting all my friends and family.
That's a great day in life, to have and then of course you have to recheck and, check ultrasound for a 6-week pregnancy and all the things that go on with that and all the excitement. But
And you guys have an office in Santa Barbara, which was very helpful. My parents moved during the pandemic from the East Coast to Santa Barbara. And so I was able to make sure that my levels were increasing at the proper rate. I was able to use the Santa Barbara office as well, which was really convenient.
People are across Southern California. You want to find the clinics that's drivable for you. So, well, that's a real journey. This is opportunities that are here and that for this generation that wasn't available 20 years ago with any good success. And like I say, the science of fertility is really exponential with genetic testing, and I think there's more to come in the near future. Hopefully we might have some testing of embryos for common diseases like Alzheimer's and autism, maybe diabetes. That would change the world in many ways.
Yeah, and it's been a really exciting journey. I now have a 6-month-old son, and
Changed your world.
it has completely changed my world. It is better than I even expected it to be, which is almost impossible.
But you've been able to
And
put all that all together as a single woman.
yeah, and there are definitely times when I've thought to myself, I understand why people do this with a partner. Particularly the first 2 months. There's not a lot of sleep. And
Yeah,
if you have someone to tag in or tag out with, that's really helpful. The support of my parents has been really instrumental. And all of a sudden when you're a single parent, you're the only one. So if you're not doing well after the delivery, you need a backup. There needs to be someone to take care of this child.
Yeah,
So,
friends and family become a huge support team, no matter what.
absolutely, absolutely. And when you work, being the breadwinner and the parent, the figuring out childcare and figuring out um, what you want your role to be in the amount of time, because it's a really tough journey, and so you do it because you really want a child, and so figuring out how to spend the most quality time with your child is a good thing to think about.
Family is the most important thing in almost everyone's life. Uh, it becomes uh, more valuable as time goes on. You made the decision very early. Lucky you.
I'm very lucky.
It's kind of the things that are important, to go through the process of, having a team. And again, that's just not the doctors, the nurses, the people who draw the blood, and the everyone that has to go into a successful process of getting eggs and embryos. It's a group effort. Again, some people do acupuncture and alternative care. Uh, we employ everything that we can to uh, lessen the stress, manage the stress as you go through this. But you could do it. It's manageable, and it's actually a little bit easier than taking care of the newborn for a few days. But
It really is. And I also did the acupuncture, which was really helpful.
yeah, it's always frightening, but to embark on a journey like that, but to have children, and as my wife said, well, everybody does it. So, if everybody does it, it means you can do it too. So then again, we talked about coping with the emotional and physical journey. You were magnificent, and it brings out parts of you that you probably didn't realize that you had in terms of strengths, uh, and those kinds of stresses help you to find out who you are in many ways, and that's what family is, and raising children is it. Stresses you in many ways, but tremendous rewards for that. Do you have any parting
I
suggestions
think,
for young women or any woman ready to start the journey?
yeah, I think definitely do it. If it's something, at least freeze your eggs because then you'll have the option. And having that option it gives you so much freedom because you do have a biological clock. And to be able to invest in whatever it is, whether it's, finding a partner or investing in your career or, you know, whatever it happens to be, freezing your eggs. And then I've loved being on, the single mother by choice journey. And, Dr. Danzer, you've been so supportive the whole way and very, that video that we watched of my transfer, the original that I have on my phone has the audio as well. And hearing you narrate what's happening, and I can't wait to be able to show my son, in a couple years. Like this was, day 6 for you, not day 1, but this was your day 6. And yeah,
This was your team to put it all together.
exactly. Exactly. It's really, they say it takes a village, but it really, really does. And I felt really supported the whole way. And I always tell my son he has sisters on ice.
That's right. That's right. Well, I think you brought up a good point too, that you need to think about egg freezing. Ideally it's best under age 35. That's when you have the greatest follicle reserve. It's intimidating, I think, for any woman to embark on this kind of project, and financially there's a price to that too. But having the ability to kind of plan your family for the future has tremendous advantages. And but it's important to get started early. The better chance of having genetically good eggs and embryos is better under age 35. And I've talked to patients all the time. Well, I know we talked about this a couple of years ago, but I wasn't quite ready, and now I'm older. Well, the egg reserve isn't quite as good as it was before. So you want to try to make that decision early. I think that's really important. There's our SCRC team. We have 3 women and 2 men, and like I say, we have about 3 to 4 locations now to provide care for our patients. Um, we'd be very happy to talk with anybody that would like to have a consultation. We can do it Zoom or over the phone, and uh, it isn't any commitment just to hear about what the process is, and it may be unique for you, but it's easy at least to take that first step. All right, so now uh, Brittany is here, our marketing person, going to tell you about some egg free cycle discounts.
All right, so from now until June 16th, we are offering 25% off IVF or an egg freeze cycle. This is in reflection to National Infertility Awareness that was started in April. And we're happy to offer this discount no matter where you are in your journey, whether you're ready to freeze your eggs or you and your partner have been trying and are curious and maybe interested in IVF. You can go to our website. It is shown above, scrcivf.com/promotions. We also are offering an in-person event on June 20th. It's a Friday. The event is from 4 to 6 p.m. We are offering free AMH testing, and that would also include a free virtual consult after your AMH blood work is received. And it's an opportunity to come to our office, look at our facility, speak with some of our physicians. And this is also your first opportunity to look at where your ovarian reserve is at. So if you are not quite ready to do IVF, but you have had that thought in the back of your head of wondering where your ovarian reserve is at, how many more years you might have as far as fertility goes, please go to our website, fill out a consult form, and get on our schedule for this free AMH event on June 20th.
All right, so we'll talk about if you have some questions. Well, somebody asked, is there a difference between IVF and mini IVF? Those are just protocols. Mini IVF is using oral medication like Clomid to stimulate the release of your own natural FSH, and then you add injectable to it. It's a protocol that's generally used for women that have a lower reserve, where you need a big boost of one's own FSH plus the injectable. But again, it's the same IVF process to mature the eggs, retrieve the eggs, and then generate embryos. Just wait to see if anybody else had any other questions. A lot of what we talked about today is on our website. I know we went through a lot of things about stimulation protocols and AMH test and follicle reserve. The website really goes through that again because we talked about a lot of different things. And it's important to become educated about your fertility future. Now, someone's asking about which part of the process do most failures occur? I think that's the question of, when you transfer embryos for IVF, with genetic testing today, high quality embryos, the pregnancy rates are close to 70% with transferring a single embryo. And that's what we did for Miranda. The other advantage is spontaneous pregnancy at age 32, miscarriage rates are 1 in 6, 15%. And mostly it has to do with the genetics, the remix of, like I say, tens of thousands of genetic pieces. But when you've tested an embryo genetically, the miscarriage rate drops down to about 8%. And that's particularly important for women who are in their 40s, where miscarriage rates are 25 to 30%. Once you have a genetically balanced embryo, the miscarriage rate is down in that 8% range. But the reason for pregnancies not to occur is really the genetics of the embryo, probably 90% of the time. A good looking embryo is going to implant, and it's up to the genetics after that. If you're asking about egg-free cycles, again, vary according to what the woman's egg reserve is, whether they got 10 eggs or 30 eggs. Someone's asked about, is Zymot always used? So Zymot is a new technology to filter out the very best sperm. It's kind of like an obstacle course. We know the sperm that swim the best on the best shape tend to do a little better genetically in terms of fertilizing the egg. So it's a new technology. We're continuing to look at ways of making IVF more successful for everyone. You had a question about, I had my first consultation yesterday. I didn't know what the question was. Good. In what situation we recommend a mock cycle? Mock cycle is usually what we do before you transfer an embryo. Mock cycles have sort of dropped out of use in a lot of ways. The mock cycle was to prepare for transfer of frozen embryo. So a woman that wasn't successful with the first transfer, was ways of, they thought, testing if the day of transfer was proper. And that was what they call an ERA. I think that's kind of fallen out of use. The most recent studies have not really supported the initial studies. And then there's another test called Receptiva, which looks for silent endometriosis. But unfortunately, that test is not panned out to be as accurate as we were hoped it would be. So mock cycles have kind of dropped out of use. I think some of the very best studies have been done on East Coast where they had two groups, a control group and a treatment group, about 4,000 cycles of frozen embryo transfer. And the control group that didn't do any testing or mocks or anything else, and the other group that had all the add-ons, after 3 cycles, about 90% of those women were pregnant, 95%. So again, it kind of tells you about the genetics of the embryo, and whether you did all the add-ons, it did not change the ultimate live birth rate. So I think that's why it's dropped out, and again, it delays things, it's costly. But again, it has to be judged for individual women or couples. Yeah, endometriosis is one of the most controversial, one of the most difficult conditions we have. We don't have a good test for it. Certainly, there are women that have endometriosis cysts on the ovary. You can see that, and you could do laparoscopy and drain the cyst or treat the endometriosis. But they estimate that perhaps 25% of all women have some low levels of endometriosis. And that's where endometrial tissue that's usually in the uterus implants outside the uterus on the ovaries or tubes, produces substances that may create problems with implantation or how the embryo is carried through the fallopian tube. It's really unclear exactly what endometriosis does to prevent pregnancies. But luckily, most women with small amounts of endometriosis get pregnant pretty easily. But there is a subgroup, and we have great difficulty in determining who in that subgroup is. And there's, again, this Receptiva test that has been used in the past few years, but it's probably not the most accurate in the world because half of the women you test are positive. And again, the treatment of, if you're positive, is about 2 months of a suppression of the estrogen, because estrogen is what supports endometriosis. So the decision to treat endometriosis is a little bit difficult today. Luckily, most women that have endo seem to get pregnant pretty easily with frozen embryo transfers. Yeah, the question again about endometriosis generally doesn't create a problem in terms of stimulation. The quality of the embryos tends to be quite good. There's some studies that say that maybe not quite as good as a woman without endometriosis, but generally you can get eggs and make embryos. And then to transfer the embryo, that's where you have to really make the decision as whether there's enough endometriosis present to interfere with the implantation. But again, most of the studies seem to indicate that women are successfully able to implant in spite of low levels of endometriosis. We just don't have a really good test to find and identify those women today. So I wish I could give you a better answer to that, but it's one of the most controversial topics in fertility treatment today. Yeah, so here's a individual man asking about how to optimize the sperm count. Just like going into IVF cycle, we talk to women about good nutrition, exercise every day, at 25, 30, 40 minutes. It's shown in multiple studies to help everybody's health and stress management. And the same thing you can say for men, good nutrition, limit the amount of alcohol and caffeine. There are some men that have slightly lower sperm counts where they have male vitamins. It's unclear exactly how helpful they are, but essentially they're antioxidants and L-carnitine. I think if you're anticipating trying to get pregnant, there's no reason that you can't take some supplements for male fertility. I think they're very safe. But a good lifestyle is probably the most important thing. But getting a sperm count before you start, I know there's some of the over the counter where they send them out to you. They're probably pretty accurate. But if there's any question, a couple that's been trying for 6 to 12 months and aren't successful, the first thing you do is get a sperm count. I think that's really important. But a good lifestyle is probably the very best thing for preparing. Of course, like I say, younger sperm is better than older sperm, but we know that studies show that sperm for men over 45, there is some increase in autism. So there is a genetic component that seems to come into play for men in their mid 40s. We know that women in their mid 30s begin to diminish their egg supply as a group, not everyone, but just probability wise. So somebody's asked the question about the difference between IVF and IUI, and why would you choose one versus the other? IUI is intrauterine insemination. What's involved is when the woman determines where she's ovulated, either by a predictor kit at home or an ultrasound that shows you the size of the follicle. The male partner comes in and gives a fresh specimen, and it takes about an hour to do what they call a swim up. Again, is to pick out the best quality sperm and the best swimmers. There's only about 20% of sperm that really swim well enough to fertilize an egg. So that's the process of an IUI, is picking out the best swimmers and then using a very small catheter, goes through the cervix into the uterine cavity, which is, again, is about 6 to 8 inches. But then the sperm is halfway where it needs to go to find the egg, which is in the fallopian tube. And the egg has about 1 day of viability. So the IUI is done just before or the day of ovulation. It's most helpful if men have slightly lower sperm counts or lower morphology. So it's a way with the natural ovulation to enhance the chance of maturing or fertilizing the egg. It's commonly used when you use fertility medication like Clomid or Letrozole. So it's kind of the first step for couples that otherwise have normal testing. If a man has a sperm count that's very low, IUI probably doesn't help, and you need to go to IVF where they can inject a single sperm into the egg.
And with IUI, you don't get a chance to test the embryo, right?
That's right, yeah, because you fertilize and uh, again, miscarriage rates are that 15 to 20% for all pregnancies. It's hugely complicated to genetically balance those embryos. Um, but with IVF, where you can genetically balance the embryo, the embryos that have the extra 21 chromosome as Downs, you're not going to transfer that. But the other extra 22 or 13, 15, the smaller ones, they cause miscarriage. So you don't transfer those. And that, again, translates to a much lower miscarriage rate and a higher pregnancy rate. Well, I'm sorry, do you help patients with endometriosis? Well, generally, if you're ready to get pregnant, that's when we kind of work with the endometriosis issue. But there are endometriosis specialists that if you're not ready to get pregnant, it's best to work with the endometriosis specialist to control pain. And other treatments, surgical treatments are available, but they're generally done by specialists today. Luckily, here in Southern California, most of the university programs have endometriosis specialists. I hope that answers your question. But we do treat it again with patients that are ready to be pregnant. So someone's asking if you're 43 is the best and quickest option IVF. And yeah, I think all the studies say that. At 43, it's 1 in 5 or maybe 1 in 6 eggs is genetically good. So with IVF, you're using fertility agents to mature, hopefully 5 or 10 or maybe 15 if you're really lucky, eggs. because we know that there's maybe 2 genetically good eggs per month. And by the time you wait till next year, it's 1 in 8. So IVF gives you the best option of getting as many eggs as you can, fertilizing them optimally, and then genetically test them. So that is the preferred way of helping people get pregnant at when you're over 40. Absolutely. Well, it looks like we've answered everybody's question. We're at the end of the hour. I hope this was helpful. I'm really grateful for Miranda and telling us her story, the a very courageous journey she has undertaken to be a mom, and hopefully you learned about the IVF process and the physiologic process also. And obviously, if any you have questions, we certainly be available to help you. Hope you have a good rest of the day. It's summertime out there. Try and get outside.
Thank you again, Dr. Danzer.
Well, thank you and congratulations. I'm
Thank
really
you.
happy for you.
Thank you.
Very, very courageous person.
Thank you.